Welcome to Physicians Keepers. Each episode features honest conversations with physicians, sharing moments that shaped them, challenged them, or taught them something worth passing on. These stories come from every corner of a physician's life: the clinic, OR, family, finances, mental health, leadership, and personal growth. If a story can help another doctor feel seen or strengthened, it belongs here. It's about honesty, courage, and community true storytelling. If you are looking for connection or a reminder that you are not alone in navigating this profession, you are in the right place. Hello and welcome to another episode of Physicians Keepers. I'm so excited to have you all here. If you're listening on the podcast or you're watching on YouTube, it's an absolute pleasure that you're joining us today. I have with me a very interesting guest, Dr. Jazzmine Basham, and I'm so grateful that she put her hands up, so to say, to be a guest on this podcast, and we're grateful for her time, for her to come share her story, because that's what we do on Physicians Keepers, right? We share the stories of doctors to let us know that, hey, whatever journey you're on, you're not alone. Someone has been there, someone's done that, so is doing that, and so you can learn all the work from her experience. And so I am going to give her a brief bio, and she can come in and fill in all the gaps that I may leave out. Dr. Basham is a board-certified family medicine physician with almost a whole decade of whole person-centered care. And this experience has furthered the charge of empowering clients to take charge of their health through education and advocacy. And currently she is focusing on, she does outpatient care and family medicine, and she's pivoting into physician-led patient advocacy. So thank you, Dr. Jazzmine, for your time today, and we appreciate you.
Wow, it's a pleasure to be here, and I thank you for having me and let me share a little bit about my story, and hopefully someone will get something out of this.
I'm sure they will. Well, thank you. So it's very interesting kind of where your story and what led you into this. Just for people who may not be familiar with the concept, what does a physician advocate do? Like, what's that about?
Yeah, good question. I get that a lot from both sides. So patient advocacy has been around for a while, right? And it's probably something that we all do, especially if we do primary care, or a lot of patient-facing work as a medical provider. So really what it is giving the patients the ability to have extra support outside of the office or the visit, in between visits, managing new or life-altering diagnosis. So this space of work is to support the patient in their care. In our American Medical Society, care is very segmented. There's specialists, there's subspecialists, there's long waits, there's insurance, and those type of barriers. So it's really easy to get overwhelmed. Even me being on, a physician and on the inside, sometimes managing my care, knowing what I need to do next can get boggled down by all the bureaucracy of things. So there is a large space of patient advocates. It can be a patient that's overcome their own medical issues and now helping others. Sometimes they're social workers or case managers. There is RNs. And then there's this very small portion of us that are physicians that are kind of leading the charge in that space. So what we do is we use our knowledge of the medical space, our knowledge of being on the other side of the stethoscope to come in and support a client, a patient that's trying to navigate the healthcare maze.
That's awesome. Now, it sounds, like I said, it's been around for a while, but I guess we've just never put a name to it when you talk about that. But your description of it kind of makes a whole lot of sense as to what it does. But what experiences, or what did you've been in practice for a while, like, was it a patient encounter, or like what made you think, okay, there is a deficit, or there's a gap that I can feel in this spectrum of patient advocacy, especially being a physician?
So there's not one big eureka. I have tons of stories. There's been tons of patients, but I think it was a small buildup ever since leaving residency. We take oaths and we're told to do no harm and that, patient care is number one, but then we're not always supported to be able to do the care that we know someone needs.
Yeah.
Or that will make the difference because, again, there's time constraints. We have 15-minute visits most time. And by the time they actually get in that room, it's really 3 to 5 minutes that we're usually the majority of people are getting face to face with their physician. And then there's insurance companies that sometimes dictate what we can and can't do for treatment. Even if there's a great medical indication. And then trying to get patients in, especially the patients that I serve. I serve in a rural, underserved area. We're literally in the valley of a mountain. So going to the next city is literally going out of town and go to the next state.
Yeah.
In the tri-state area. So seeing all those barriers to the care that I want to provide my patients, it just weighed me down a lot. Burnout is real. And I think the statistic is high of how many physicians are already trying to do their exit strategy because practicing, especially primary care medicine right now, is extremely taxing. And then you are trying to do your best, but then patients sometimes they get worse and not better because of all these barriers around what they should be getting. And so it's kind of my way to fight back. I still see my patients. I still am actively practicing and I do the best I can every single day for them and I show up. But this allows me to serve others and use what I know in a different manner to really empower them, make sure that they are being supported, that they get the help that they need. And most of the times the people I see, they've tried everything. They've played by all the rules. They've done all the things that they're supposed to do. And then at the end of the day, they're in the same spot or worse off than when they first try to seek care and help. So it's kind of the last resort a lot of times and just trying to feel better, trying to get better.
That's amazing to hear that. And thank you so much for stepping into that role. Like I said, I'm primary care, so I do know the time constraints that come up because you have all this in between visits with specialists, right? And the common thing is patient is coming back to you at the time that's meant to discuss something else, to have this explanation about what just went on in the specialist office.
Yeah.
And it's like, okay, I think I sent you to the specialist for a reason, but then they're like, well, I feel like they told me this and they told me that, but I don't think I understood it. So, and so then they come back to you, it's like, hey, tell me what they said. Tell me what they're doing. Like, I don't understand it. Like, why this, why that? And because we're primary care, and they have that trust with us, they can trust us more. Not to say our specialist folks are not amazing, but we build this long-term relationships. And we're usually the ones that put the referral. Yep. So then they come back to you, it's like, yes, okay. And then you have to then go back to the specialist notes, and then you have to get all that information, and you have to explain the thought behind it. And sometimes it's the patient's refusing to do what the specialist said to get done. And then they're like, well, give me another option. And we're like, well, if there were an option, I would not have sent you to a specialist in the first place, and you have to kind of walk their hand, and just take them on that journey to say, okay, this is what you need to be doing. And with the system, like you did mention, and you highlighted so many great points, the system can be very daunting to a lot of patients, where they anticipate that I have insurance. Why are you telling me I can't get this?
Yeah.
I have insurance. Why are they not covering for this? I have insurance. And one of the sad things, and I don't know if this is something that you've seen a lot of, I'm sure you have, where you have patients who've reached a certain age and believe that, well, I think I need help with stuff that goes on in my house. I need a home aide. I need someone. My insurance, send me someone. My insurance should pay for that. And it's like, well, not really. I mean, they will pay for a home health to come, but a home aid is a whole different thing. And so there are a lot of complexities to patient care. So I can definitely see why, as a physician, knowing the ins and out of it, how being a patient advocate, you would actually be, like I said, you be in the best position to serve patients. So thank you so much for that. But you did one question I did ask, which you did mention it, and I'd just like you to kind of expand on it. Why do so many patients feel overwhelmed in navigating the healthcare system today?
And that, I think, is the $1,000,000 question. And I think it's because one, we're not doing well on our part on educating the patient, on next steps, what this test means, what it's going to help me decide, what would be the outcome of these things that we're doing, why we're doing it. There's countless feedback I've heard, like, yeah, I was told I need to go see the specialist, but I don't know why I'm going. Or I was told I need to go get this image or these labs, and now I have a bill and I still don't know why I did it. No one's gotten back to me. I'm not sure, what's next after that. Like, what do I do? I did it, and now what? So there's a lot of those gray areas. So I think one of the majority part, and especially as a primary care provider, like you highlighted, we're kind of the ones with our boots on the ground. We have the most interaction. We know the patient usually the most. We know their whole history, not just system based. That the specialist usually will address one thing or one system, where we see all the things, and we've seen them for years. We know their social economic status. We know what it took to get to that visit that day. We know, their family troubles or what's going on locally in the area. So we can put all those things together. So I really do think we are in the best position, as primary care providers, to really make sure what we're doing is being explained, and letting the patient have a clear understanding of what their care plan is. And a lot of times, especially with the portal system, they can see everything, but they don't know what that means. So I just think there's a gap of knowledge, a gap of explanation. And there is really a way that we can train up our patients so that they feel empowered, that they feel like they're part of their care and not just a passenger in it. And that has also sparked another passion of mine, which is educating patients on how to be a great patient, like how to take that control. I think there's been a big shift. Maybe traditionally, most patients just accepted what the doctor said and said, well, that's what my doctor said to do, so I'm going to do that. At least I've seen, and I've heard many other physicians talk about a transition of patients really wanting to know whys and why nots are coming in, internet. So it's really easy to look up what they think is going on and have something set in their mind. And I think we have to really shift from being paternalistic to being collaborative, right? To be joint in their care. Be active, have them be active players in what is going on with their own health. And that's really the only way we're going to try to rebuild a lot of trust that I've seen lost in the medical health system and with physicians, so that we really can make an impact and really fulfill what we're supposed to be doing, which is providing high quality care.
That's awesome. I mean, you highlighted so many important things that I reflected on as you were talking. And I remember this encounter as a resident, just to show you how, from a primary care standpoint, how we do get the brunt of things. I was in my dermatology rotation, and the patient walks in, and I'm shadowing and just kind of observing from the side, right, while I think it's a resident or attending doctor is talking. Just patient comes in and it's like, hey, what's going on with you today? And patient's like, oh, this hurts here, and da 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 da, I ache, and this has been going on. And the dermatology resident attendant, I don't know, I can't remember who, smiles and it's like, I'm just here for your skin. Tell the rest to your BCP.
Write that down and take it to them.
So it's like, yeah, we can't, as primary care, we can't say we're not interested in any part of you, because Jessica, we have to have that interest in every part of you. And you also mentioned patience, right? Having that mindset of, oh, just tell me what to do and I'll do it. Or I'm just following my doctor. I'm like, well, you're actually the driver of this vehicle. Mm-hmm. Like, I'm just a passenger. Like, you're the one that should be navigating certain things with your health, right? I'm here to give you advice. I'm here to, steer you in the right direction, but don't put all the responsibility health-wise on your doctor. And you also mentioned the portal, which we recently switched to Epic. Oh, and wow. Yes,
that's in my Epic portal.
Yes, I bet this 4 months ago, and I had to create a patient template specifically for Epic, like a whole note I give patients on their way out. And what it says is, you may get to see your results before I do. Try not to freak out, just kind of paraphrasing, and call the clinic the next day and say, why is this red? Like, why is there, like, when they're looking at their labs, right? Why is there a red mark here? Why is this there? Which is great that you want to know these things. And I just say, hey, there's a whole lot of volume that comes with that. I'm not going to be able to review 25 patients' labs within a 24-hour period, right after work. Like, if something looks off, we will call you to tell you. But then, like I said, from an education standpoint, now there's ChatGPT, there's all sorts of things. Patients can look up a whole bunch of stuff and have their own diagnosis, or figure out why they want this, or coming saying, order this lab for me, get this done for me. But so we have to sometimes talk them off the ledge and be able to educate them, like you said, give them that information to say, okay, this is why I'm doing this. Yeah. I'm checking this blood work because this is what I'm looking for. Like, I'm not just a random, I'm just going to draw your blood because you're here for a physical, but when I'm checking your CBC, I want to know this. When I'm checking your liver enzymes, it's because I'm looking for this. When I'm checking for this. So they're not stuck with a bunch of blood work labs that they get a huge cost for. And then insurance is like, oh, we're not covering that. And they have no clue. It's like, why did she order it in the first place? It's a thing from a primary care standpoint. And you would definitely relate with that. I have this whole thing I put on I have this Instagram channel. I educate patients, Dr. Addy Talks. And I'm like, you need to know why you're taking the medications you take. One, you need to know. If you come in and you're saying, why are you taking this? I don't know. My doctor said you gave me, or they gave me. It's like, that doesn't help. As a patient, you still need to know why, because one medication can be for 10 things. And then you're looking at me to figure it out, but I didn't start you on it. So you have to know why you're taking what you're taking. You have to know the exact medication. Not tell me it's a blue pill or it's a little white pill. I can't help with that. So I can see how you giving patients that information, empowering them to be in charge, to know exactly what's going on in their bodies and making informed decisions based on that is such a vital piece of patient care. Yeah. It's such an important thing.
And like I said, I think all of us want to do it. All of us have that desire to make sure our patients are not feeling more confused when they leave than when they came in. But we don't always have the resources to do that. And so, like I said, this new position I'm in, or this new role that I'm taking on as a physician, but also as a patient advocate, allows me to fill in those gaps that others have just not had the opportunity to do.
Yeah.
And if one patient is able to feel like they made an informed decision, then that's just all the affirmation I need.
That is awesome. That is awesome. Now, just based on your knowledge, what are some of the simple things that patients can start doing on their, to become better advocates for their health?
I'm so glad you asked. So one of the best thing is be prepared. So like you said, especially if you're going to see a new provider, or let's say you haven't seen your physician in a little while and you had a couple other visits, your medications changed, you might have some new diagnoses, and some symptoms now, even after seeing those specialists. Come prepared. Like you said, know what medicines you're on. The pharmacy is a great resource. You can ask them to print it out for you. What's the last medicines that you had? Or if you've been seen by one provider, they should be able to provide those notes. It should be on your portal. So having that, taking that, knowing what questions or what is your goal for the visit, right? If you're going to come see me for physical, I guess your goal would be to make sure that everything looks good, everything's healthy. I'm up to date on my preventative screening. There's nothing else I should be doing. I'm not missing any recommended vaccines. So, or if I'm coming in for a migraine, I want to know what it's possibly about, what we need to do to work it up or treat it, and then when I need to come back if it's not getting better. So having a clear agenda of what you're going in for, having questions and symptoms outlined. I tell people just write it down. When my patients come in with a list, I say, I'm so glad you brought that list, because then I don't have to worry about when you leave here like, oh, I forgot. And then there's a message and you can't get through to the nurse because it's just a busy day.
Yeah.
Or you're like, oh, wait, while I'm walking out the door, and then we have to come back and kind of reassess everything. And sometimes I don't always have the full ability to do that. So for even my clients that I do advocacy for, I'm always big on be prepared, have an agenda, and then have good follow-up. So say, hey, you're doing blood work today. How long should I expect to hear for? What is it being done for? What is it going to change in my treatment plan? And then when should I call you, or when should I come back again? So that you're not wondering, okay, well, I saw them, they said do this, but I don't know what to do next.
Yeah. This is such amazing questions. I've learned not to be afraid of the list.
Yes.
I'm like, well, we may not be able to go through all the 10 things on the list, but I can do the first 3 and bring you back for the others. Right. And it's like, hey, I brought a list. I'm like, yeah, that's fine. I love a list. That way, like I said, I'm not walking out the door and then just anything else. And as soon as I leave, it's like, oh, I forgot.
Yes.
And it's like once you've already mentally checked out from that patient, and then having to kind of reprogram yourself, and then it's another, because then you have to sit down again and all that. So having a list, if you're a patient, and when we're talking about patients, even as physicians, we are patients too, mm-hmm. right? And so these are things we also need to know for ourselves, right? And because it's one thing being on the other end, it's a whole different thing when you're at the other end of the spectrum, right? When you are the patient and you're going in there, you've received this diagnosis and you're scared. At that point in time, your physician brain is not functioning. Like you're in patient mode, mm-hmm. And so you also need to know what to do when you're on the other side of that. Now, are there any questions that patients should never be afraid to ask their doctors?
Yeah. Can I have a second opinion? So I think, that's a big one too, that we have to feel comfortable first with the patient asking us and how we will react to that. And
Yeah.
sometimes that could be acknowledging that, maybe it makes us feel like we're not trusted, or maybe it makes us feel like, oh, well, do they not want me to care about for them? But sometimes it's because what you're telling them to do is really hard to accept. And just like any of us, if we're going to have a huge renovation on our house, right? Or we need a plumber and they come in and say it's going to be thousands of dollars. How many of us are not going to be like, wait, I should probably get another quote or so?
Yeah.
And then if someone else tells us that, or the next two people, it's easier for us to understand and make plans, and make arrangements to do what we need to do. But I think as physicians, we need to not let that bring out insecurities in ourselves. And if it does, acknowledge those, because the best thing that can happen is that second opinion could make the patient seek the care and get the care that they really do need, instead of just get overwhelmed and, burrow down in distrust and be like, well, I'm just not going back.
Yeah. Yeah. And like it's such an important question. And like you mentioned, as physicians, we should not take it personal. I always tell my patients when they ask about something, I'm like, you are never tied down to any doctor. Yeah. Like, there's no stamp on your forehead that says that this is this person's patient. And I'm like, even if you feel like it's me, like if you feel like I'm not communicating well enough to you and you feel like you want to hear something different from someone, please feel free. Like I'm like, please, I promise you my feelings will not be hurt. If you say, I don't think as much as we don't want to admit it, not everyone is for everyone. And that's the honest truth. Mm-hmm. Sometimes it's a personality thing. I've sent patients to doctors who I think are great communicators. Yeah. And the patient is like, they're too chatty. I don't want the doctor to be too chatty. Like, and once they already have that bias, I already know that they're not going to receive everything the physician has to offer. Mm-hmm. So I'm like, well, you may want to find someone who's more suited to your personality. I mean, you can be the nicest doctor, but it just may not be the right one for that individual. So having, patients make that decision to say, okay, go find another specialist. Like I can definitely, if you want me to put a referral to someone else, absolutely, I can do that. Don't be afraid to say, I need to seek some other opinion. Like that's your right as a patient.
Yes, exactly. And patient's right, I feel, is something that's downplayed a lot. Some people that come to me don't even know that their records belong to them. Like it's their property. We hold them, but it's their property. Or that they can ask, for a second opinion, or they can ask to see a different specialist, even though they went to one, that they can say no.
Yeah.
If that's what they decide is best for them, as long as they have the education, they understand the benefits and the risk. The empowerment part, like I've mentioned, I think is what's missing most, and really coming alongside the patient instead of being, like you mentioned, the driver and they're the passenger. Yeah. So at the end of the day, they're going to have to deal with their health, the consequences or the benefits that come out of treatment or no treatment, because it can go either way, right? They're the ones that have the long-term effects, and their families, and people that care about them. And while we want to do no harm, it's easier to harm if we're not involving them in their choices and in their care.
Absolutely. And like you rightly mentioned, they have a right to say no to care. And as physicians, we should never feel like we have to pressure them to say yes, even though it's in what you may say, okay, well, it's in your best interest. But at the same time, like I said, they have a right to say no. And I see that a lot, especially with primary care. So the screenings, right? Yeah. I have folks who would, no, it's never going to happen. what about this? What about this option? It's like, no, if something's wrong with me, I don't want to know. I'm aware that, fine, you may say if there's cancer, but if it's my time, it's my time. Like, I don't want to do anything invasive. I don't want to do anything aggressive. I don't want treatments. I don't want none of that. And I'm like, so long as you are aware of everything that it involves, you're making this decision not out of pressure, you're making with all the information in front of you, then it is absolutely all right. I'm never going to pressure you to do a screening that you absolutely don't want to do, because then it makes no sense if I screen you and you say, well, I don't want to do anything about it. Well, why did I screen you in the first place? The whole reason behind screening is if something's there, we need to intervene. It's not just for you to know that it's there. And so having, like I said, having those conversations with them, letting them know it ultimately is your decision, but you have to make sure you're making it from a place of grounded information and not fear.
Yes.
Because sometimes fear can be a driving factor when it comes to patients making decisions. Like, I just felt so afraid and so pressured, I just said yes in the moment, to it, without knowing what it may look like at the other end of the surgery, without knowing that if, even if they say it's a gallbladder being taken out, and they're like, well, you can do without your gallbladder, but at the same time, there are other things that may happen, complications and stuff like that. And they were like, well, no one told me that this could possibly happen. Maybe I would have said no, but I felt like I didn't go in with the right amount of information. And so it's, like I said, I feel really, I'm just really glad that we're having this conversation, and knowing that these are patients, fears and concerns, and hopefully the physicians hearing it can understand what it feels like from the patient side. And that just makes me go. So the next question I want to ask you is, from the physician side, what do you wish more doctors understood about the patient experience outside of the exam room?
It's complicated, For us, I think we have an advantage, but I'm sure there's many of us who've had to go through the system and seek care or seek a diagnosis when there wasn't anything clear. But patients are not only coming to their primary care doctor, but then they're going to have to go schedule imaging, get lab work done, see 2 or 3 specialists, and having to not only logistically figure that out. I don't know if you've tried to get an appointment with even a primary care doctor here recently, but most people are months out.
Yeah.
And so a physician is using, or a patient is using the ER or urgent cares, and then all this information is scattered, and then they're getting repeat imaging because you don't know what happened, because it's been in so many different areas. But they were just trying to do the best they could, because we couldn't even see my primary care doctor for 3 or 4 months, and I'm having acute issues. So access is a huge thing. Then getting into specialists who are months out, and then getting imaging done, and you have a full-time job, and you have children, and you have to take off work, and now you're trying to decide, do I pay for this image or this medication, or do I buy groceries for the week for a lot of people who I see individually? Those are real life decisions that go into just trying to feel better. So with the complexities, it's hard for us, even in the physician side. I think most people can understand it's hard for us to get and navigate our patients care. It takes a lot of time, energy, and effort. And then imagine being on the other side when you don't have as many resources as we do, and you're trying to get or get treatment that you need. And it involves multiple steps and multiple people. And then you get bills and on top of all of that. So I think it's just very complex. It's very segmented. And we need to have better bridges, and we need to have better communication. We need to have a wraparound system. But unfortunately, I don't see that happening anytime soon, at least not that I know of. Us especially the physician advocacy space, a lot of us do medical navigation so that we're able to make sense of whatever diagnoses or treatment plan, but also help, detangle the jargon and the
Yeah.
coding, so that patients have the best opportunity. Like I had my most recent client has wonderful primary care team and support, has multiple specialists that have been involved in their care for a long time. And for months, though, her insurance wouldn't pay for a treatment that everyone said that she needed.
Yeah.
So it really just took me working alongside her to get the insurance to cover what she needed, and just me helping, being there, answering questions for the insurance, kind of pushing back. We were finally able to get treatment that was indicated and necessary.
Yeah.
But imagine someone who's already not feeling well, who's already done all the things you told them that they have to do and still hitting walls. It takes a really resilient person to keep on pushing without any help or support in this system.
It does. It does. And, we see those patients all the time. I mean, not everyone is straight bread and butter. Some people are so complex. I mean, going back to recent interactions, I mean, there was a patient that I think that just that visit, there were 3 referrals to specialists that went out, and I'm having to tell her, you have a lot going on. And it's understandable to feel so overwhelmed with it. And here we are, I'm sending you to 3 different specialists just in one visit. And I wish I could tell you that I can't, these are, like I said, these need specialist intervention. I can't handle them. I know you want your PCP to take care of it, but I can't. You need to see this person. You need to see that person. You see that person. And this is just one visit. So you can imagine what that looks like for her, where someone, she's getting the phone call, trying to schedule this. Someone else is calling her. She needs this. And then you're saying go to physical therapy, which, physical therapy you're going to take time out of your job to do that. Right. And then, yes, multiple times a week. And sometimes you have to pay out of pocket, for, you have to pay a certain fee out of pocket to even start that. And so when we see patients come back and you say, did you go see a specialist? And they're like, no, I didn't. Sometimes there's a little more behind that, no, I didn't, than we think. Sometimes it's not that they're refusing care, but sometimes it just they were like, I can't, this is just too much for me. I can't take out time for my job. I can't. This is an extra, this new medication that you said is so great, that's going to work to help my kidneys. I'm paying $40 a month for it, and it's too expensive for me on top of everything else I pay for.
Yes.
Right. And so I'm really excited for you in this journey, because I believe that it is really needed in the healthcare space. And I'm hoping that a lot of physicians will be able to collaborate with you to help improve patient outcomes. But so how can physicians, how can we effectively collaborate with physician advocates for our patients? What does that look like on our end?
I think it's just being informed that it's even a thing. And before I became an advocate, I was like, what is this? I knew what I wanted to do. I knew that this was missing. I knew that it was so much in need, but I didn't know it was a space or a name to it. And people actually, this is what they do. This is their business. This is how they help enhance the patient experience. So I think knowing about it, and then being open to it. So I always, whenever I attend a visit with a client or have to call on their behalf or send a message, I'm always like, well, I hope that they're nice, because, they probably don't even know what this means. And we already have so much coming at us as, as a medical physician. Mm-hmm. And we're like, wait, what is this? Why is someone else involved? It kind of just puts your little radars up.
Yeah.
But really, we just want the same thing you do. We just want this patient, your patient, our client, to get the care that they deserve and to live a whole life. So we really want all the physicians I know and have talked with and been mentored by, we really just want to collaborate. We want to be of help. We want to fill in those gaps that we know you can't do, because we're there. we've been there,
Yeah.
and we want to be used as like an asset, a resource. So we're not competing. We're not there to butt heads. We really want to be on the same side to get the goal done.
Well, thank you so much. Like I said, this is very new information for me, especially with this. So it's definitely something that I can see how beneficial this would definitely be, especially for complex patients in the healthcare system. So I'm sure every physician hearing this would love to collaborate. I'm hoping, and not butt heads, based on, because the goal is patient care, right? Optimal patient care, patient education, great outcomes, right, for our patients. Now, you've had to switch with this field that you've gone into entrepreneurial mode, right? How how was that for you? Was it just an easy transition? Does business, like all these type of things, come to you naturally, or are you just so efficient, or was it, okay, what am I actually doing?
Yeah, it's a huge learning curve, and I'm still learning every day. One of the best things I could do is get a mentor, and I actually went through a course from a
Awesome.
fellow physician who's been doing this for a long time,
Yeah.
and learned, all the tips and tricks and what step one was, did step one, what step two is, and not try to, build the pyramid in a day. And
Yeah.
like I said, it's been very rewarding kind of seeing something that started as an idea and a hope
Yeah.
turn into something that's actually been, viable, beneficial to the people I've been able to serve, and allow me to kind of fill in those gaps where those burnout, where that disappointment was
Yeah.
coming. I wasn't able to accomplish in my day-to-day clinical. So it's been so rewarding, so difficult, but I've learned so much. And I know I'm still have tons more to learn, but we're resilient. I mean, we're high achievers, we're
Yeah.
capable, we're able. If you're a physician, you have already everything in you that you can do this by yourself, that you'll figure it out, you'll find a way. And I think that's just been the fun part, is seeing me stretch so much in a space that I'm uncomfortable with.
Well, thank you for sharing that. I mean, what you mentioned is actually a common thread, when I talk to physicians that are, going into different fields other than the traditional line of medicine, is, you all share the same mindset in a way where you say you're open to growth. Right, you're ready to be stretched. You didn't just jump into the pool and just start swimming. You found someone who was already swimming,
Yeah.
and you are like, hey, like, you've been navigating these waters for a while. Like, show me where to swim, right? Show me, like, and you didn't isolate yourself. So those are really great tips. And you kind of moved into the next phase of the question I wanted to ask you, was that what advice would you give physicians who feel called to address healthcare gaps in new ways? What advice would you give them? And you already shared some of it with just what you said, but is there any specific advice before we round up that you want to give to a physician who's like, oh my God, what Dr. Jazzmine is doing so awesome. Like, how can I reach out to her? Like, how can I contact her? Like, I want to do something in what she's doing, but maybe in a different way. What advice would you give them?
Yeah, you have to start someday, so why not just start, and then
Yeah.
you'll figure it out. You're gonna fail, you're gonna get it wrong, you're probably gonna get a couple headaches and bump your head against the wall,
Yeah.
but eventually all those things are gonna lead you in the right direction. So just stay encouraged.
Yeah. Well, thank you. So if someone wants to contact you, just ask questions or check your website out, see what you do, how do they get in touch with you?
Yeah, so my website, and there's plenty of opportunities on there to send me a message, is a course of care. So that's COURSEOF care, CARE.com. and it'll lead you to my advocacy page and kind of what that looks like and what I offer. And then on social media, I'm on LinkedIn. You can find me on my name right there on the screen. And on Instagram, which is where I do a lot of my educational patient-related material, is _advocacy doc. That's TOC. And you should be able to find, and you can message me there.
Well, thank you, Anna. I would make sure to include all that information in the show notes. And so if you want to reach out to Dr. Jazzmine, just make sure you use all those. She's giving you all the resources everywhere to meet her, so you can go contact her. But Dr. Jazzmine, thank you. You have been an awesome physician's keeper today. You have been an awesome educator. And I thank you for everything you do, both for the physicians and also for the patients at your end. And we appreciate having you here today.
Thank you. The honor and privilege has been really mine.
Oh, thank you. And if you are a physician and you have a story to tell, you have anything in your career path, anything in family life, navigating this field as a physician, navigating life, and you have a story you want to share, make sure you send me a message, drremla@gmail.com, and I'll put all the information. And we would love to hear your stories. We would love to hear your experiences, because your story might just be what another physician needs to make it through the day, to make it through a challenging time, to take that new step that they've always wanted to take, but they were not sure and they were afraid. But you showing up and being a physician's keeper lets them know that it is possible. So appreciate you today, Dr. Jazzmine.
Thank you.
Thank you for listening to Physicians Keepers. I hope today's conversation gave you something useful to carry into your life or practice. If it resonated, share it with another physician who might need it. And if you have a story that could help someone else, I'd love to hear from you. Connect with me on social media or send me an email. See you in the next episode.